Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
We are live on YouTube as well as Facebook right now. It is Good Morning Dr. Day, and today we welcome Dr. Vincent Po, neurosurgeon from Mount Elizabeth Hospital. Good morning, Doctor.
Good morning, everybody. Glad to be here.
Thank you so much for being here, because I think this is a topic that a lot of people have a lot of questions about. We're talking about hidden stroke and aneurysm risks that we need to know, even though you may think you're young and healthy.
Indeed.
I remember my first memory of someone who had a stroke was when I was very young, and my mom had a friend who was in her 30s, and all of a sudden we heard that this auntie was in a coma. You know, completely in a coma. Her whole left or right side was gone. She had no movement. I mean, this was, as a child, this was scary. And I'm like, what do you mean it came out of nowhere? Do strokes come out of nowhere?
Indeed. In fact, most of the strokes, by definition itself, really is due to either sudden bleeding in the brain or sudden blockage of the brain arteries itself, and therefore it's usually on sudden onset. It can really come out of nowhere. But in most of the time, for strokes, there's usually some associated risk factors, such as blood pressure, cholesterol, diabetes, and all that.
Okay.
Right. Also, we're asking this question this morning, remember, is a stroke the same thing as an aneurysm?
Well, actually, the stroke is the biggest classification, and when you have a stroke, you can be due to a blockage of the brain vessels itself, or you can have a brain hemorrhage or bleeding into the brain substance or anywhere within the brain itself. So, for example, if you have an aneurysm rupture, that will be causing bleeding in the brain, and that's one kind of stroke. It also comes with a definition that you should have some deficits, meaning that some numbness, weakness, because some people will recover very well. There's definitely evidence of previous hemorrhage, but they recover absolutely well with no deficits. Then you may not be of a long-term sequelae of a stroke.
So do people walk among us with clots and bleeding without actually slipping into a coma?
It depends. The degree of bleeding itself can be very mild, very subtle, presenting with headaches and all that. And once you treat it and for example, aneurysm rupture, if it's a small leakage, you treat it, you can recover with no deficits. But it really depends on how extensive the hemorrhage was at that beginning and how much of a brain injury you have after that.
So headaches are no joke, just like pay attention to that, like we said last week, right?
Right.
Yeah.
But most of the time, our headaches are hangovers.
Yeah, you know, your headaches.
Anyway, I'm speaking of celebrities. Early on, we were talking about Justin Bieber's wife.
Yeah, Hailey Bieber. That's right.
She recently had
stroke.
something like a stroke, right?
Yes. Yeah, I think she has transient ischemic attack. Basically, it means that you, in a very short period of time, you develop weakness or numbness, but you recover very quickly. Okay. And so that's what it means by transient ischemic attacks. But it's usually a harbinger, and there's some way of doing risk assessments on whether you are going to progress on to a permanent stroke or a higher degree of stroke itself.
That's exactly what happened to my dad. He had 4 TIAs.
Excuse me?
4.
Wow.
Transient ischemic attacks, right?
Yes.
Is that what it's called?
That's right.
Yeah, and he's completely bedridden now. So,
I'm sorry to hear that.
No, it's been a while, so.
Okay. Let's continue to talk to the doctor on the Big Show TV. Meantime, here's Chapel Roan with Hot to Go on Kiss 92.
5, 6, 5.
So is that, I mean, like Hailey Bieber recovered from it.
Yes.
My dad didn't.
Yes.
Like, what would be the difference between the two? I know you need to see them and like each case is different, but I mean, just from your knowledge.
As what we were saying just now, it really depends on the severity of the stroke. That means how much of the brain injury they had during either the blockage of the stroke itself, is a large area of the brain, or whether the most important area of the brain is affected. And that will then determine the outcome of the stroke sequelae.
Okay. So it's where it is.
Where it is and how extensive, what percentage of the brain is affected, and which critical areas will be affected.
So which is the most critical area of the brain?
Actually, the I mean, brain is all important.
Okay.
But the most critical areas, for example, will be the brain stem or the deep nuclei of the brain itself, because they control a lot of our basic functions, including our wakefulness, ability to breathe, movement, recognize, and all that. But that's so-called most critical areas. But the whole brain is important.
Because it's like the control center, right? It tells the whole body what to do, right?
That's right.
Because neuro-wise, there's so many things, right? That's like even Parkinson's is a neuro disease, and then there's also dementia. What can people do to stimulate their minds? Like sometimes when I sit down and I talk to my mom or my aunties, they're always saying, you know what?
Mahjong.
The way we stimulate our minds is we play mahjong, we play jin rami,
puzzles. Yeah,
but is that true? Is that even useful?
I think the general recommendation is true, to be mentally active and to get involved in as much critical thinking, a lot of activities, because that's really helps you to keep it. You use it and you keep it. If you don't, then both exercises. So you need to do the mental exercises, you need to do the physical exercises. So that complements, and you really need to do that so that the circuits and all that is better.
So would it be correct to say that the brain needs a good blood flow?
I was
blood
just
flow
ask,
to the brain.
Yeah.
Oh, definitely.
So like headstands and all that. Not headstands, but when
Like
we do
hanging,
yoga,
inversion.
for example, inversion. Sometimes you get the blood, rushing down to your head. Is something like that recommended or good?
Yes. Actually, in terms of the brain blood flow, our body organs tends to try to maintain in a very good constant environment.
Okay.
So within a range of blood pressure, the flow is actually auto-regulated. That means you control the amount of blood flow you need. And if the brain pressure drops, your blood vessels dilate in the brain so that you maintain the flow. So you don't really need to actively try to increase the flow because it's self-regulatory. In fact, when that regulation gets affected in stroke, in trauma, then that's when you really need the precise control to make sure that you don't drop the brain pressure so much or blood flow pressure so much that you have insufficient blood flow to the brain. But most of the time we are self-regulating.
Okay. So leave it to the body.
Don't have to do anything.
Right.
Yes.
Okay. I had a thought in my brain. I've lost it.
As long as I was about to say, as long as because stress is also very bad for the brain, right? Yes. So for let's say couples or whatever, if they're having arguments all the time, or you're having stress at work, you're just really feeling like the world is about to collapse on you. That's when...
Can it bring it on? Can it bring on a stroke?
That's when your blood pressure goes up.
Yes. I think in general, the emphasis is on mental health, the ability to actually be able to relax, to know and to reduce consciously, cognitively, how to bring down your stress level, learning how to manage stress is very important. There are evidence about stress and stroke, but it's difficult to really put it at 1 + 1 = 2, kind of very simplistic because of the evidence behind it. But I think it's in general, the mental well-being, reducing stress does reduce your overall physiological balances, because stress can cause all the blood pressure rise and all that, and that's so for a continuous sequelae of brain injury, strokes, and all that.
Are there any preventive measures that we can take? Like, I know a good lifestyle, healthy eating, you keep your cholesterol low and all that. But what about brain scans?
Yes.
Just to check and make sure that nothing is clotted, nothing is too thin, too thick. I mean, is that available for people who, just want to make sure that they're in the clear?
Yes, indeed. I think most important is to have symptom awareness. If something is wrong, you have worsening of headaches. There's actually some guidelines in MOH itself to talk about when you should go for scans. Right. What are the red flags of headaches itself, such as fevers, weight loss, sudden onset of kind of headaches, that with the guidelines, you should go for a scan.
Okay.
Then there's also indications on if you have genetic risk factors, that you should then go for scans if you have heard about it. Or when we have 2 first-degree relatives who is known to have an aneurysm rupture, first degree meaning siblings, parents. Yeah.
So it can be linked to family.
In general, if you do have 2 first-degree relatives in the family that has a history of hemorrhage or stroke, and I'm talking about aneurysms itself, then yes, you should be going for an aneurysm screening.
Aneurysm screening, okay, which is the same as a stroke screening. No.
It can be both.
Okay.
When you go for the MRI, they usually cover both.
Okay.
Yeah.
Wow, okay.
And that's so sucky, right? That's
Yeah.
like within the family, and it's true, So both my parents have hypertension, and about 8 years ago, when I went to check, my pressure was also a little bit high. And then it started going up a little bit higher. So now I'm actually taking medication. I mean, it's a very tiny tablet, which I take with my vitamins in the morning. But just to be on the safe side, I opted, for medication. Is that a good thing?
Yes, indeed. The whole idea of awareness of family histories of hypertension, and you have gone for screening and find the early detection of hypertension and control it. Obviously, in the beginning, you would do the lifestyle modifications, and after that, and the next one is really be starting on medication and compliance with the medication to reduce your risk factors from all the long-term sequelae of hypertension.
Right, because I've got many vices, doctor. Let me just tell you that. So I was thinking, I'm like, okay, if I'm going to continue to drink and stuff like that, then I better take
Preventive
something
measures.
to stabilize it a little bit more. Okay, stand by.
Kiss 92 traffic.
On the PIE towards Tuas after the Adam Road exit, avoid lane 1. An accident has been called in. Also on the PIE towards Tuas, same stretch, but this time after the Thompson Road exit, avoid lane 1, another accident. If you have any other news for us, let us know. 8855509020.
Welcome back to The Big Show and The Big Show TV. It is Good Morning Doctor Day, and today we are happy to be talking to Dr. Vincent Po, neurosurgeon from Mount Elizabeth Hospital. And so far, we've clarified quite a number of things already regarding strokes.
That's right. Doctor, I had a question which completely slipped my mind earlier. You were talking about it being... you having the possibility of getting a stroke or an aneurysm if you have family members, first degree family members that also suffered from it. So is it a DNA thing or is it because of lifestyle? Because when you tend to live with people, you tend to eat the same things, you live the same kind of lifestyle, whether it's active or not, you kind of like you do the same stuff. So is it down to consumption and lifestyle or is it down to DNA?
The answer is that it's not binary. It's actually a combination of both.
Okay.
You most likely would have some genetic disposition to form these weaknesses in the wall itself. Okay,
Right.
And it's not a specific identified gene now. I mean, they have gone through a lot of genetic studies that certain people with this kind of genetics may have a higher predisposition to form the aneurysms. But the subsequent component, the environmental factors such as smoking, high blood pressure, uncontrolled, will then increase the aneurysm formation and the progression of the aneurysm. And so then that increases the risk of rupture itself. So you can't really change genetics except being aware and then go for screening if you have, like what we mentioned, all the genetics, family history. And then for aneurysm per se, then prevention of smoking, making sure that hypertension is well controlled will be important.
Okay.
All right. We've had more celebrities actually, suffering from strokes or getting a stroke. Emilia Clarke, actress in Game of Thrones, and in fact Sharon Stone as well.
That's right.
Had strokes. Did they fully recover? Because I don't know. I've not heard from Sharon Stone in a long time now.
Sharon Stone had it a while ago. She did recover, and Emilia Clarke as well did recover.
Right.
Yeah, but that's a good question though. Recovery. Some people seem to recover better than others. Why is that?
I think it really depends.
Severity?
Yes, and the biggest performance is how bad was the bleeding in the beginning and how fast you actually get it treated to prevent the risk of rebleeding after the first rupture. So that's number one. And if there is a lot of damage to the injury of the brain itself, actually the recovery can be very good. And so now with the modern technologies, treating the aneurysms actually is fairly standard at this moment. So it really and coupled with after the hemorrhage itself, a good rehabilitation and program itself is also important to really optimize your brain recovery.
Okay.
So actually, after saying all that we've said, you really don't know. I mean, when you're going to get an aneurysm, or if you're going to get an aneurysm.
I want to get my brain scanned. I really do. I mean, because you can not have headaches and still be at risk, right? It's not just the headaches, right? It can be a silent, sort of invisible thing that just hits you, or
Indeed.
never.
I think when we come back to aneurysms, we did a survey, a proper study itself, to say that if you're looking at all the MRI scans that we have done for patients who have gone for incidental screening or headache scans, you can pick up aneurysms at about 2%. So it is actually fairly common to have a brain aneurysm. Fortunately, most aneurysms don't rupture, and so with a small aneurysms, you will then need to observe with all the detailed MRI scanning that we do now, and then you probably have to do all the advanced risk modifications and calculation, looking at aneurysm risk and all that, to decide whether you should be treating.
Okay, let's find out about that, the treatment. Because if you see something on the scan, and what do you do then?
Yes.
Let's
continue to talk to the doctor on The Big Show TV. Meantime, here's Benny with Super Lonely on Kiss 92. But it's not common, right, for people to go and for...
Well, incidentally, he said, like, if you accidentally spot it through another, because you're doing another scan, you sometimes do spot clots.
But it's rare. I mean, usually if there's no problem, people won't just go and get themselves checked.
So if you are completely have no symptoms at all, then you really shouldn't, at least in official stance, is not a routine unless you prefer to do it on your own executive screening. But as a guideline, it's not that everybody hit as moment you go, because there'll be too much of a consumption of resources. But if you have symptoms such as a sudden onset of headache, a change or weakness, visual problems and all that, and when you consult the relevant specialist, then they will probably order a scan for you.
Okay, so what happens when you spot a clot or say anything that you're in danger of? What's the treatment?
So once you have diagnosed that there is actually a brain aneurysm, sometimes you need to go some more tests just to look at the configuration of the aneurysms. Sometimes you will need to do some advanced MRI imaging of vessel wall to see whether there's inflammation around the aneurysm wall. And then to look at the size and the dimensions, coupled with the factors, whether there's family history, there's history of hypertension and all that. You calculate, and there's actually ability to then say in terms of the studies, what is your risk of rupture of that particular aneurysm based on the location itself. And then you make a decision whether you should treating the aneurysm. When you decide to treat the aneurysm, then there's a whole range of treatment options that you have, going from the minimally invasive, you can put in coils, you can put in stents, to even open surgery. So it really depends on that kind of configuration of the aneurysm, because sometimes it's very small, it may be difficult to treat. It's very large, the neck itself is very complex, then certain kind of treatment may be necessary. So that's when you will need to then see a specialist to actually make a decision what is the best way forward.
Okay.
Wow. Okay, I mean, just now we spoke about smoking is bad, and but I didn't hear you say alcohol is bad for the brain.
He was hoping you'd stay away from that.
If I had to choose one.
Smoking, well, obviously smoking is never recommended, but alcohol...
Then I smoke cigars all the time.
Alcohol in moderation is okay, right? But smoking in moderation is also not okay, right?
Exactly.
Yeah.
So the risk factors for aneurysm itself, smoking is a higher risk.
Okay.
Alcohol is less associated,
but
excessive alcohol is still bad.
Do you hear that?
Whiskey and cigars. I mean, that's my thing now, right?
Moderation.
Okay.
Okay. I wanted to ask you about aspirin, because even for a lot of people take a little bit of aspirin to keep their blood flowing properly. You know, it's a little bit thinner and stuff like that. When my dad had his stroke, they put him on blood thinners. Then it was too much blood thinners, so then he had hemorrhaging because everything thinned out too much.
Oh.
So then they had to coagulate the blood again, right? Thicken the blood again. So what do you recommend or not recommend when it comes to self-medicating with aspirin to keep your blood flow sort of smooth?
I think aspirin itself, interestingly, is a very controversial topic, because when you talk about bleeding, and aneurysm, because of the blood thinning effect of aspirin, it makes sense that you should avoid aspirin, because if you bleed, if the aneurysm rupture, because you're on blood thinning medicine, aspirin itself, then the bleeding may not clot, and therefore, because of more extensive bleeding, you have more brain injury.
Yeah.
But there is actually an ongoing trial, because the other aspects of aspirin besides the blood thinning is the anti-inflammation aspect of it. And there is now studies to say that aneurysms may be associated with the wall inflammation of the aneurysm itself, and by taking aspirin, you may actually reduce the inflammation of the wall, and therefore reduce the aneurysm rupture, and also reduce prevention. There's an ongoing trial called in US itself called the Protect You study, and I think the verdict is still out at this moment.
Okay.
I'm not sure.
We have a question from Lance, who messaged in a WhatsApp. I had a cerebral AVM hemorrhage when I was 12.
Yes.
Although I had no stroke aftermath, but hemianopia, how do you pronounce it?
Hemianopia.
Hemianopia, okay. Was AVM caused by the aneurysm? Was it genetically passed down? Because no one in my family has cerebral AVM. I was told by my neurologist that I was born with this deficit.
I think AVM itself, arteriovenous malformation, is another kind of vascular blood vessel conditions that can occur in young adults, like in this patient, and it can rupture. But it's actually slightly different. It's a different pathology altogether. So for brain AVM itself, then it's usually associated with congenital. That means you're born with it during the formation of the blood vessels itself, and that have a risk of rupture, usually at about 2% per year. And when you rupture, and when there's a bleeding itself, it can affect the brain. So just now, when you talk about hemianopia, it means that one part of the vision of the field is affected, and so that's probably from the sequelae of the AVM rupture.
So was it genetic?
The AVM formation is most likely genetic, and
Okay.
then it ruptured, causing brain injury.
Can you spot things like that when a child is born? That they're going to, say, experience something like this at the age of 12, because you said young adults, right?
Yeah, through advances in technology.
Yeah.
If there's a specific reason that
To
the
check.
child has to go for a scan, usually a child will be an MRI for the to detect you. It's possible to detect, but obviously not everybody will put their child through this kind of imaging.
And what kind of reasoning would it be, though?
So within the pediatric world or the young adult world, again, if there's symptoms of strokes or weakness, numbness, persistent especially in children, they rarely have headaches. So if they start to complain of headaches and all that, you need to see a pediatrician to make a decision whether then the scan needs to be done.
Yeah, wow. Okay.
There's so many reasons for people getting headaches.
Yeah.
Which is why I'm thinking, after, obviously many people are watching this session and will be watching, this session, they will be, I think they'll be a bit more cautious. And I think maybe that's one of the reasons why we have this segment called Good Morning Doctor anyway, to raise awareness of certain things, like persistent headaches, go see.
Go get it checked.
Even if it's a GP that you're going to go and see them. And if they feel like you need a referral to a specialist, they will refer you to a specialist, But there are many people who just,
they pop a Panadol and
all
it
the
goes
time,
away.
or some painkiller, but they don't realize that, this is actually happening more frequently than normal.
Yeah. I mean, if you missed last week's episode with the doctor as well, she was talking about headaches and migraines, and that was a very interesting one. That also leads to, all the other topics that we're talking about today.
Yeah.
Okay.
I mean, I like paracetamol.
For your hangovers.
Before I get a hangover, I'll take 2 paracetamol.
Yeah, you're taking it for a completely different
I'm
reason.
Very bad. Yeah, I got to wake up at 4:45, right, to do the show. Okay.
We have
going
some
for a traffic
questions
update.
later
Yeah.
on air.
Okay.
Kiss 92 traffic.
If you're on the KJE heading towards the BKE, look out for a vehicle having trouble before Sungai Tengah's exit. Also on the PIE towards the airport, an accident before Simei Avenue, causing a backup all the way to Bedok North Road. Avoid lane 3. And finally, on the PIE, towards Tuas, that situation after Adam Road's exit is still there. An accident taking up space in lane 1. If you have anything else for us, it's 8855
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Vincent Po, neurosurgeon from Mount Elizabeth Hospital. I mean, if you've always wanted to see a neurosurgeon for some reason, please look Dr. Ng up. You know where to find him. Mount Elizabeth Hospital.
Absolutely. We have a question from Yerim on Facebook. And Yerim is asking, are teenagers and or young adults at the risk of getting aneurysms and stroke, since mental health and stress from work and school and everything else is all the hype now?
The answer is, for younger population, there is a higher genetic component to it. If they develop strokes, for example, they are rarer causes, and so not the garden variety of hypertension, hyperlipidemia, strokes. If strokes happen in young adults, then there's usually certain genetic components, Moeller disease, and formation. Even for formation of these aneurysms and special blood vessel problems that cause hemorrhage itself, there's a certain component that's more related to the genetics component itself.
Okay. How do you know someone is suffering from a stroke? I think that's really important. I think it's the face
That's right.
method, right?
I think most of the time, I think it's the FAST symptoms,
Fast.
right? The fast, right?
Yeah.
So you have the facial asymmetry, the arm weakness, the speech difficulty, and the last one is time. So within that short period of time, if there's a suspicion of stroke and all that, you should call 995 as soon as possible and go to the hospital, because large majority within that golden hour of 4.5, they can give some clot busters kind of drugs to do, and now they can even talk about retrieving clots from the brain blood vessels itself.
Oh, wow.
If it is the garden blockage of the strokes itself, if it's the usual brain hemorrhage from hypertension bleed as well, that golden hour will also allow you to bring down the blood pressure as much as possible, and also to reduce the risk of the hemorrhage expanding and all that. And so even for aneurysm rupture, going back to the hospital early will allow for early scan and early detection to see what is the next thing you need to do.
So you mentioned the golden hour is 1.5 hours?
4.5.
4.5 hours,
Yes,
okay.
but as soon as possible should go. if
Okay,
there's
you
no
don't want to sit around and have tea and coffee and all that, like
Yeah.
go straight to the hospital.
Most people,
okay.
the trouble is, most people will say, I'm having a lot of headaches, or I'm having this weakness. I'll sleep it off and I'll get better. But the trouble will be that Yeah,
The longer you leave it, the worse it.
that's right.
Yeah,
I guess, okay.
That's a possibility.
It
Like,
is.
okay,
I'm
just
fine,
go and
I'm fine,
lie down,
Yeah.
and then see
Arm
what happens.
hurts a little
when
bit,
I
but
wake
it's
up,
fine. Is it ever left or right, or it doesn't matter? It's either or?
Yeah, it can be either or.
Okay, all right. So that's something to look out for.
All right. Not to scare you folks, but whatever it is, if you feel you need to see a doctor, please do it.
Yeah.
Don't delay for whatever illness.
Yeah, if you're suffering from headaches, migraines, or
Yeah.
remember the FAST method as well, within 4.5 hours. If you're just tuning in now, you can always go to YouTube because the whole video will be up there.
That's right. Thank you so much, Dr. Ng, for joining us today.
Thank you. Glad to be here.
It's been a pleasure speaking to you.
You've been listening to Uncover Invisible Health Threats. Are you